Hey, my friends. Welcome to the High Performing Dental Team podcast. And I have a very special guest on the podcast today because we are talking about one of my favorite topics, practice metrics, numbers. I'm all about data-driven decisions. I'm kind of a numbers geek. And so anytime I can talk about practice numbers, I absolutely love it. So I have Robin Smith on the podcast today. She is a solution consultant with Henry Schein One and has always worked with the Jarvis product. Jarvis is a online analytics dashboard, as you may well know, that pulls data from your Dentrix software, puts it on a beautiful dashboard, and you can see your practice numbers anytime you want. And I also love it that Robin has worked in your shoes. She's been in your shoes. She's been in the dental practice before. She has been in private practice for about 19 years. She started out right out of high school where she was a sterile tech. She was a dental assistant. Then she went to hygiene school. She was a hygienist and then transitioned out of private practice and now is working for Henry Schein One. So thank you, Robin, for being on the podcast today.
Thank you for having me, Dayna. I'm excited.
I am too. I love these kind of conversations where we can talk about a metric that's happening in the practice. And then we can talk about, so is our practice within that industry average? Are we in the 10% of practices? How can we make those numbers better? What can we do? And so I'm really excited that you'll have the perspective coming from the clinical side of being in a practice and now in the solutions consultant role, and you have these metric numbers to look at. So I'm excited for the conversation because, you'll kind of have the clinical conversation and I'm more on the admin side. So I'm really excited for it.
Yeah, me too. It's going to be an awesome combo.
So where this conversation is actually kind of coming from is Henry Schein One came out with their 2025 Catalyst Index report. I know that's a big word. They could have named it something a little bit more easy to say, but this report is let's see, let me pull it up really quick. I think it's like 29 pages long.
Yes, it's a long one.
It's a long one. But what I love about it is that we get to see practice numbers. So Jarvis pulled data from about 3,000 locations. Is that right?
Yep, just a little above 3,000. Yeah.
Okay. And these practices some of them are private practice, some of them are DSO. Do you know kind of like what the mix is a little bit?
Yeah, it was about 75% of the locations were DSO practices, 25% were private practices.
Okay, perfect. So it kind of gives you a little bit of idea of where the numbers came from. I look at practice numbers every day. I mean, for me, I keep it simple. I just look at the practice advisor report in Dentrix, but the Jarvis gives you a whole bunch of data. And Robin and I are going to kind of just give you our favorite takeaways from this 2025 index. Now, if you want to download your own version of it, we do have the link in the show notes for today, so you can download a copy of it. But we're going to pull a couple of our favorite numbers, and we're just going to kind of dive into if your practice isn't quite in the industry average, you want to be more close to the top 10%. We're going to talk about kind of some ways that you can do that.
Yeah, absolutely.
Yeah. And
we have that in common, Dayna. I'm a numbers geek now too. I didn't feel like I ever was when I was in the clinical space, but I am now.
Well, numbers tell a story, and numbers tell us when our systems may be in trouble. It may tell us when our systems are working really well. And so I use numbers a lot for helping practices improve systems. And I also use numbers to celebrate.
Sure.
When you were in your own private practice, did you look at practice numbers? Did you have like goals and you looked at numbers when you were in a practice?
It's so interesting because it was almost like taboo. We didn't look at numbers.
Interesting.
as a team. The doctor looked at some numbers were pulled for her and given to her, but we really never came together as a team and said, this is where we're at for hygiene reappointment or case acceptance or
Yeah.
even a goal. We didn't have that. And now in hindsight, I wish we did have that, because it actually gives us all something to drive towards. And you're right, it tells a story of some kind. And if you're not getting that story, you really don't know where you're at. And I feel like there's a lot of times where we think we're at a certain place, and then we look at numbers and we're like, and it's a humbling experience to learn that maybe you're not doing as well as you thought you were, or maybe you are doing really well and you didn't realize it. So it's interesting, because I think sometimes, especially in private practice, it's something that people don't know, and they need things like this and amazing people like you to tell them, hey, this is what you need to be looking at.
I agree with you. A lot of times I have challenges getting doctors to be open, honest, and transparent about practice
Mm-hmm.
numbers. They're
Yeah.
like, oh, no, I shouldn't show my team those numbers. And I'm
Right.
like, you absolutely need to show your team those numbers. And
Definitely.
and I mean, there's really about 5 or 6 key metrics that are really important. Yeah. And I came from a practice complete opposite of yours, where we looked at numbers almost every day. Yeah.
Yeah, definitely not something that it was kind of like, how many openings do you have in your schedule that you could see? That was like the extent of our numbers. Or,
Mhm.
the doctor would tell us we're down or we're up, but we never really knew or understood, and I didn't realize at that time my impact in that. Although now I can tell you what the impact was. I can tell you how I impacted retention or impacted reappointment rate and things like that. But when you're not actually given the number to look at, I think it makes it's just not concrete. So it makes it harder to really connect with it.
For sure, for sure. So that's my first number that I want to talk about, because patient retention is my favorite metric. I really love to look at patient retention. So just to give our audience a little bit about what the definition of patient retention is how many patients, recare patients, are coming into our practice within the usually like last 12 to 18 months. Is that what you're seeing?
Yep. Yeah. Typically 18 months is the default, but everybody kind of has their own number
Yeah.
there. But that's
I
the
usually
default.
I usually look at 18 months as well. How many of my recare patients have come in for their recare visit within the last 18 months? And so looking at the Catalyst Index report, what it's showing us is, and these are numbers pulled from Jarvis Analytics. They looked at a little over 3,000 practices. The industry average for patient retention was 72%, and the top 10% of practices was at 95%. And so I guess first off, what's your first initial takeaway of those numbers? There's a big discrepancy there.
Huge.
Yeah.
Absolutely. And I think it's really what is the driver behind patient retention and what our practice is actually looking at. If it's not a number that you're regularly looking at and you're just like, well, my schedule's full, so I must be doing good. And you're not actually paying attention to who's coming back, within a period of time, it could give you a false sense of security there. And I think, with the 72% being the average, I definitely could see how that would be. 95% in the top 10%, it's really high. And those are probably your practices that are really making sure they're not letting patients fall through the cracks.
Exactly.
And yeah, one of the things that we see a lot is new patient growth. I want to grow
Mm,
my new patients. I want more new patients. And it's not focusing so much on existing patient retention.
I
And I
agree.
really think we miss the mark there sometimes.
Well, I agree with you 100%. I think if your patient retention is low, 72% is low. If your patient retention is low, let's say it's at 70%, I mean, 30% of your patients are walking out the back door and you're never seeing them again. So if you're losing 3 out of every 10, so what you're really saying is that 3 out of every 10 new patients that are coming in are leaving. And so, it costs the practice a lot more money to acquire a new patient than it does to retain an existing patient.
100%. Because what are we paying for to get the patients in the door? We're paying tons of marketing dollars.
Exactly.
We're paying money for, different things to draw them in. And, we're giving gift cards if, you bring in a new patient or you come in for this. We're giving free treatment away, right?
Yeah,
How many things do you see like free set of
I know.
bite wings or a free exam? Great
Exactly.
things, really great things to do to attract new patients. But if at the same time we're bringing those in and actually kind of paying for them, we're also letting money leave by not
Mhm.
making sure that our patients that are there
Exactly.
are well taken care of. So really, really big piece in patient retention there. It really is top three.
I agree with you. And so what do you think, as a having a hygienist background, what do you think that we could do internally in the office to help increase that patient retention?
Yeah. I mean, I think first and foremost, number one thing that we can do for patient retention without us having to actually do anything to, call patients and get them back in and re-engage them is just the relationships that we build with our patients.
Exactly.
If you create something with a patient, whether you're the hygienist, the assistant, front office, doctor, it really doesn't matter. Every single person in the office has the ability to create a relationship with somebody where they're like, I'm never going anywhere else.
Yes.
I don't ever want to go anywhere else. I want to come back and see them. And I want to, and that was really one of the biggest things I had as a hygienist was building those relationships and wanting the patient to come back and see me every 6 months.
Exactly.
So I think that's like first and foremost thing that anybody in the practice can do.
I love
And
that.
then making sure we schedule. Just make sure you schedule your patients. Don't let them leave. Don't let them tell you, I don't know my schedule that far out. Okay, let's just get you in somewhere. And then if you need to change it, no problem.
Yeah. Yeah. Pre-appoint is also really important. I love what you said about relationships. I mean, we are in a relationship business. I know
Yeah.
when I was in a practice, I mean, it was always, we were talking about each other's kids
Yep.
and our weekend, or, it's almost like a social event to go to the dentist
Yeah.
sometimes. Even though we are a healthcare facility, we also really want to have those authentic connections with our patients. And I think another thing for hygienists is staying on time.
Yes.
That's another internal marketing tool that we
Yeah.
can use to increase patient retention. Staying on time, making appointment booking and confirming, making all of that easy for the
Yes.
patient. Ease of use and convenience. Everybody wants things now,
Oh,
and
yes.
everybody wants things conveniently, and they want it on their own device. And so
Yep.
not only the relationship building and staying on time, those are some internal things that you can
Hmm.
do, but we can also do some external things to also grow those relationships with convenience for the
Yeah.
patient and making sure that things are forms and booking are all easy as well for the patient.
Absolutely. We have to. You really don't even have a choice anymore.
I know.
It used to kind of be, well, like we were paper charts until pretty shortly before I left the practice.
Mhm.
So
Oh, wow.
yeah, it was a very long road to get to that paperless point. But, there are just things like people don't want to fill out a paper form when they come in. They
Right.
want to do it on their phone. They want to do it before they come if they can. And if I even think of myself as a patient, right, I'm going to book my appointments online too,
I do
if I
too.
can.
I do.
I mean, I like talking to people, but I want to talk to you when I'm there. Like, let me just book my appointment because I'm not going to remember to call you on my lunch hour or
Exactly.
we're going to play phone tag or whatever it might be. So you really kind of have to get with it now. It's
I
just the
agree.
way it's going.
I agree with you 100%. 100%. Good. So those patient retention is, I mean, we could flip patient retention today. It's just
Yeah.
relationship building, staying on time, ease of use for patients, convenience, all of those things we can start doing today. I mean, those are things that we can start doing today.
Don't make yourself replaceable, right? Dentistry is one of those industries I feel that once you find a dentist or a dental team that you trust and that you feel comfortable with, it's a place. I mean, let's be honest, it's a place that a lot of people feel anxiety. People don't like with someone in their mouth. They don't, if they find a practice they love for their kids, for themselves, they're not going to leave. And it's
Right.
really up to us in the practice to make it feel that way for them.
Agree. Agree 100%. Um, Now the other, so then let's kind of pivot into another really big takeaway that I loved seeing in the Catalyst Index is case acceptance. So another place where we can easily change the trajectory of the amount of treatment that patients are saying yes to.
Yeah.
So the big takeaway for case acceptance was industry average, pulling numbers on the Catalyst Index, industry average for case acceptance is 47%. Whew,
Yeah.
boy, I know. And then the top 10% of practices, their case acceptance is at 83%. So, first kind of first impression of that, of those, the big difference between those two numbers, between the top 10% and industry average. What would you say about case acceptance?
Yeah. There's so much to say around this topic. It's probably one of my favorite KPIs to talk about. Little hard to measure, right? And there's so many things that go into play there. But look at this. It's almost double from the
Yeah,
average to the
I
top
know.
10%, which is wild. But if I had to tell offices one thing that impacts this rate so much, it's your treatment plan hygiene. And it's what I mean by that is, what does it look like when you're treatment planning, and what are you doing with those treatment plans afterwards? Are we
Okay.
treatment planning 3 options, patients picking one? What are we doing with the other 2 options? These
Okay.
things can really impact the way that metrics appear in areas like Jarvis Analytics. So that's one thing that is really huge, that I don't always think that our admin teams in our practices really realize the impact,
Okay.
right?
Yeah. Yeah. So you're saying, like, when the doctor is giving the patient options, so let's
Mhm.
say bridge, implant, RPD.
Yeah,
So they may be giving the patient these three options for missing teeth. But then when the patient schedules or does something with what they pick an option, then you're
yes,
saying that the office really doesn't have a system or process for what to do with the other two.
exactly, right.
Okay, got it. Yeah.
Yep. So do we remove them? A lot of people don't like to remove them, which I understand, because you want to know that you put those other options out there. So I get that part of it. But there's reject options in
Yes.
Dentrix and
Yes.
a lot of management systems that I think a lot of people just don't use. But we have things in place in a product like Jarvis where we can exclude rejected treatment, so it's not impacting your numbers.
For sure.
But that's definitely a big one, because then when you're trying to follow up with your outstanding cases, then you're not sure. Am I going to
Mhm.
accidentally call this patient? They already had the RPD and they don't need the crown anymore. They don't need the implant, or so now it just makes things messy, and then it makes it really hard for your team to know what they actually have the ability to impact.
Yeah. Yeah, I agree. I think case acceptance is one of those practice metrics that affects the whole team.
Yeah.
Because the treatment planning, the education, all is happening in the clinical room, all happening with
Mhm.
the hygienist or the doctor. And a lot of times the patient is saying yes, yes, yes in the back, and then
Right.
they get up to the front and they're like, that's going to cost me how much? you know and so it also is about um the ability for offices to help make dentistry affordable,
Yes.
and being able to have those really good conversations with patients about how can we provide patient financing, or how can we
Right.
really maximize your dental benefits as much as possible because we know that's important for you. And so a lot of it has to do with verbal skills, communication,
Yes.
and all of that.
The relationship thing comes into play again. I really feel
Yes.
like that just touches so much of it, because we need to build trust with our
Mhm.
patients, and they need to feel trust in the operatory, and they need to feel trust on their way out when they're talking to our front office team members. So, you know, Education is a big part of that. We need to make sure that, admin team up front understands the procedures and is able to answer questions about them. And if they're not, that's okay, but then having the ability to go grab the doctor or grab the assistant that can talk to the patient if they're feeling unsure about something. And I think there's so many products out there that are coming out now. I mean, AI is already revolutionizing dentistry, but
Yes.
things like Detect AI that is helping patients see it. It's
Hmm.
different if I'm telling them, like, you have perio pockets of X amount and there's bleeding here and bleeding there. But if they can see bone loss,
Yes.
or, going back to the finance part of it, eligibility pro and being able to do checking automatically there and be able to, quell their fears of it's going to cost me this much. Well, okay, but your insurance, we don't need to do the whole like 2-week waiting game of let's see what your insurance is going to cover. I think all of those little things kind of coming into play and just helping to make them feel comfortable is
Yeah.
going to increase case acceptance.
I agree. I think like what you said, going back to the relationship, like
Hmm.
knowing what those patient motivators are.
Yeah.
And, is the patient motivated by shorter number of appointments because they have a time issue? They're a busy
Yeah.
person.
It's a
So
great one.
time might be a motivator. Are they motivated by aesthetics,
Right.
because they're in the public eye a lot, or they're a public speaker, or,
Yeah.
they have something where they're in the public eye a lot. So their smile is very important to them. Is price very important to them? So how can we offer this patient, their motivators or price? So how can we offer this patient financing
Yeah.
options? And when we know, kind of, we can identify what the patient motivators are, then we will get more patients to say yes to treatment.
Yep. Got to speak their love language, right? That, I feel
Their
like
love
that
language.
connects
Exactly.
everywhere.
Exactly. I love that. And, so it just kind of naturally flows from, the clinical room, talking to the patient about
Yeah.
what their expectations are and what
Hmm.
their goals are for their dental health, their oral health, and
Yeah.
having a really good handoff, to the
Yes.
whoever is going to be the person on your team. I was in a Facebook group today, and the question was, who should be presenting treatment? Yeah, who should be presenting treatment? And my response is, because almost everybody in the thread said front office, front office, front
Yeah.
office. So I said, my response was, whoever has the verbal skills, the communication skills, and is not afraid to talk about money, and
Hmm.
who has those really good patient communication skills to talk to patients about, the treatment, the money part, and the scheduling. I don't care who it is on the team.
Yeah.
Anyone on the team can present patient
Absolutely.
treatment, as long as they have the communication skills needed to talk about money. And
Hmm.
because that's usually the big
Oh, yeah.
motivator, usually, is money.
Yeah. I mean, for me too, when I go in, it's like, okay, I need to know how much this is going to cost, and then I'll make my decision from there. But honestly, I mean, and I'll say, even when I was a hygienist and I worked in pediatrics, so,
Okay.
I was, looking at x-rays of kids and looking at these parents, and I'm like, oh gosh, I don't want to tell them that they have decay on 12 teeth right now on
Yeah.
their first set of x-rays that we've ever taken on them. And sometimes, I'd always feel it out, and this is where that comes into play of like reading the cues. And
Hmm.
if I felt like it was better for me to go pull the mom aside and be like, listen, before the doctor comes in and you get like really overwhelmed, and
Yeah.
I would kind of at least rip the band-aid off and chat about it a little bit, and just to kind of help with those things. But yeah, I mean, I don't think there's one person that should be given all of those discussions, because
Exactly.
I think you just have to figure it out, and on a case by case basis with your patients.
Yeah. And I also feel like case acceptance can also be increased by, you know, having those conversations about money and insurance benefits in a very open, honest, and transparent way,
Yeah.
and we want to be open and honest about patients, about the limitations that they have with their benefits,
Yeah.
and let them know that, this is a plan between your employer, and, so if you
Right.
do have limitations that are in your plan, the best thing to do is to talk to your employer, so I'm having those conversations about that treatment is based on your provider and you know, we try and leave the insurance company out of it and really talk to the patient about what their out of pocket expenses are and helping them afford it. So
Yeah.
I think that all comes down to relationships, which is like the number one thing that
Yeah.
has come out of today for sure.
You wouldn't necessarily think like metrics, relationships, but honestly, so much of dentistry is feeling and the things that it makes us all feel, you know. So I love that that came out of this.
No, I agree too. I agree too. So there are so many numbers in this catalyst. I was just gonna those were our two favorites. Patient retention is my favorite, and case acceptance was Robin's favorite. So we got to pull what our favorite topic was for today. But when you download the Catalyst, what you're going to also find is like gross production per day. You're going to see gross production per day for a general dentist, collection rate and time to payment, and all of those. Like, there is so much data in this Catalyst. And I also loved that they have some experts that have given their feedback as to what this Catalyst, what the numbers have to say. And so that was really a really nice touch in the Catalyst, is having some feedback from some of our industry experts,
For sure.
like Heidi Arndt. I've known Heidi for a very long time, and she's a really big player in the DSO space. And I trust her and admire her and really love her insights. So I love that she was part of the Catalyst, and so that was really good to hear. There's a perio percentage number in the Catalyst that I think was also very interesting. So I would love to hear some feedback. So what we would love to get your feedback on, there's always a comment section. You can always share this podcast with your colleagues. If you're in a study group, this would be a great podcast to share with your study group. Get this Catalyst Index out to all of your doctors so they can look at it, see where their numbers are falling. And if you're not using an analytics dashboard, if you're not using Jarvis, maybe it's just not something that you're ready to do yet. I can help you with pulling some of these numbers from the Dentrix Practice Advisor report. A lot of the numbers in the index, Catalyst Index, you can pull from the Dentrix Practice Advisor. So we can at least look at those together. I'd love to, analyze your Practice Advisor report. But I know Robin would love to get you up and going on Jarvis if
Anytime.
you were interested. And so if someone's listening to the podcast and they want to learn more about, okay, I loved reading the Catalyst Index. Oh my gosh, I really want access to these numbers for my practice. How does someone listening to this reach out to you?
Yeah, absolutely, guys. So you can definitely head to the Henry Schein One website, henryschein1.com. One is spelled out, O-N-E. I'll also give you my email address. Anybody is welcome to reach out about more information with Jarvis. So it's Robin Smith, super simple spelling there, Robin, robin.smith@henryschein1.com. Again, one is spelled out. So definitely feel free to reach out. And guys, when you're looking at these numbers, don't feel like you need to take every single one of these and start working on them tomorrow, because you will feel very overwhelmed. So maybe pick one or two that you want to focus on for a short time and just see the impact that you can make, and share these numbers with your team and really make it something that you work on together as a dental family in your practices.
I agree with you. I think sharing numbers was always a monthly meeting for my practice. Even though we looked at some numbers every day, but we would always have a team numbers meeting.
Mm-hmm.
And then what we would do in our practice is our hygiene coordinator would present the patient retention number. And this is what we have in our practice currently. This is where we're seeing our hygiene department. And then like case acceptance, maybe our doctors or our dental hygienists would present that number. So it was always a team involved
That's awesome.
event. Yeah.
Yeah.
And that's how I think it should be, because I always think of it kind of like a sports team.
Mm-hmm.
If you don't know what the score is,
Yeah. How
And you
can you
don't
do
know,
anything?
how can you don't know if you're going to win the
You
game,
can't
you know?
learn from that. You also can't build from that and celebrate that. And I think that's one of the most exciting things is to celebrate. If you
Exactly.
see, collection rate go up 3% in a month, that's super exciting.
Yeah.
So,
Yeah. Yeah, exactly. Exactly. This has been really
a lot
good.
of
Thank
fun.
you. Yeah,
Yes, thank you
absolutely.
so much for inviting me.
I think that we gave everyone some really good tips on just some really simple things they can do in their practices to help improve the numbers if they feel like maybe their numbers are a little bit lower than industry average, or maybe they want to jump into the top 10%. I mean,
Yeah,
that's a really good goal to have.
it sure is.
Absolutely. All right, everyone. I will definitely have Robin's contact information in the show notes. I'll also have the Henry Schein One website in the show notes. I'll have a link to the Catalyst so you can download it specifically. You'll just have to give your name and email, I believe, for to download the Catalyst index, and then you will have access to it. It's 29 pages long, so it will be some, good afternoon reading for you.
Yeah. Enjoy, everyone. Good luck.
Everyone. Thank you, Robin, so much for sharing your afternoon with me. And I look forward to maybe our next conversation.
Thank you, Dayna.
All right, my friends. Well, thank you for joining us today for this podcast episode. Again, we love 5-star reviews just like you love them in your practice. So please rate, review, share this podcast with your friends and colleagues. And I look forward to watching your journey of becoming a high performing dental team.